Medicare Open Enrollment, which opens up, I believe, next week. Michelle is going to give us some insight on that. But I have certainly learned a lot whenever we do a discussion on Medicare. It's confusing. It can be intimidating. It can be something that really concerns you because you might feel like you could lose benefits. It's also something to be very aware of because you may be helping your clients or your loved ones navigate this maze of Medicare. And so this is a great discussion topic. Kate and Michelle, really excited to have you here today. Before we kick things off with Michelle, Kate, I first want to really thank you and your team at Virginia Hospital Center at VHC Health. I still call it Virginia Hospital Center. On being one of our positive aging community champions and such a great partner over the years. But in bringing this topic and Michelle to the table so that we can have a discussion. So before we meet Michelle, Kate, tell us a little bit about yourself and the VHC organization.
Wonderful. Thanks, Steve. Great to be here today. Good morning or good afternoon, everyone, for the most part here. I am Kate Tutwape. I'm the manager here in the Senior Health Department at VHC Health or Virginia Hospital Center. We respond to either one. We are just really excited to be able to bring you this topic. Our group offers monthly presentations throughout the year on webinar format. And as I work with Michelle closely on different issues and topics, and as we were chatting recently, we thought, you know what, this is a perfect topic, Medicare, to bring to the to this month and make sure that we get it in before the open enrollment period starts. So really happy, Steve, that you were willing to kind of co-host this with us. But yes, our department, we do a variety of community programs throughout the area, a lot in Arlington, but even throughout Northern Virginia. I was just at bingo size before I came to this webinar. So we were at Walter Reed doing bingo size.
Okay, wait a second. Bingo size, never heard of bingo size, but it sounds like something that we've got to do a discussion on.
Yeah, I mean, it's as fun as it sounds. So, but it is. It's actually an evidence-based program.
Oh no, I read an article about it, but we have not done a discussion on bingo size.
Well, we should talk you through it, and yep, it's a combination of exercise, bingo, some education around fall prevention, and that's a big area for us to talk about, fall prevention and what we can do to help people mitigate their risk. So, yeah, so we do a lot, and of course, we do our lifeline services as well for those individuals who live alone or have fall risk or any health risk really. Lifeline's a great resource to have available. So we help folks with that also throughout the area.
Awesome. Kate, when you and I go behind the curtain, if you don't mind dropping all your contact info into chat and any links that might help people in the audience or people watching the recording to get in touch with you. All right. And so this kind of leads to this discussion. So we've been alluding to the day that open season starts, but what is the day that open season starts, Michelle?
October 15th.
Okay, so it is next week. All right. So this is really timely.
Yes.
And then Michelle, I know you got a slide deck and you're going to go through that, but I want to remind folks, the best thing about these discussions is they're live and interactive. So you can ask questions, you can make comments, you can share resources. 3 ways to do that: type it into chat, use that drop down that says everyone. Second, there's a little Q&A box at the bottom of your screen. You can use that and type it in. When we open the discussion up, if your preference is not to type in a question, if you verbally like to express yourself, raise your little virtual hand and I'll open up your mic and you can ask that. And that's the other reminder. Folks, you can just sit back and enjoy the discussion. You don't need to worry about your mic and camera suddenly popping on. The only way that happens is if I do it. So, Michelle, tell us a little bit about yourself before we dive into your presentation.
Absolutely. Thank you so much. My name is Michelle Thomas, and I serve as the program coordinator of the Arlington County's Virginia Insurance Counseling and Assistance Program. It's a part of Arlington County's Area Agency on Aging, which I've had the privilege and the honor of working with for over a decade at this point. My role entails being able to provide services, advocacy, and spearheading programs that help older adults and individuals with disabilities maintain their highest level of independence, health, safety, and well-being.
Awesome. Now, you're Michelle, you're with Arlington County in Virginia.
Yes.
But and a lot of this that you're sharing with us is going to be universal for people that are in other states and counties. Is that correct?
Yes, that's correct. The Virginia Insurance Counseling and Assistance Program is one umbrella of the State Health Insurance and Assistance Program, which I'm going to talk more about. It's across the United States of America and has 54 state grantees. Thank you, Steve.
I love it. I love it. And I'm not putting you on the spot, but now we're going to transition to you, your presentation. But I love this. Edith, you get a gold star. Edith has already asked a question. We haven't even said anything, but I want to read Edith's question to you, and you can either answer it now or you can say, oh, I'm going to answer that later, Edith.
Okay.
It says, Edith asks, I've been told Medicare Advantage is for people who cannot afford insurance. Is this correct?
Oh, surprising question. That is not correct, and I'm going to speak more to Medicare Advantage as soon as I get through. I think it's probably mid slide deck. Thank you,
Okay.
Edith, for asking that question, but that's not
Thanks,
correct.
Edith. And also, Michelle, I've done 350 of these discussions, and every single one, a question comes up that I'm like, wow, I could have never, I didn't know people wanted to know that, so it's, so this is one of the coolest things about our community here. So,
and I thank her for being brave. She's the first person to ask a question. Thanks again, Edith.
No, that's why I said she gets a gold star. So, okay, folks, Kate and I are going to dive behind the curtain. And remember, just feel free to drop in your questions and comments, and we'll definitely get to them. And if somebody asks for some clarification on a slide, I may interrupt you, Michelle, and just say, hey, go back over that. All right.
Okay.
So this is awesome. Really looking forward to the presentation. So if you want to share your slide.
Okay.
You got it there?
Yes, here we go.
Okay, awesome.
Okay. Thank you so much, everyone, for joining us today to talk about the Medicare open enrollment period. I will shed some.
Hey, Michelle, I don't mean to
Yes.
You're on preview. So go up where it says display settings at the top. And
yes.
Pull that down, and then let's see. I'm swap presenter to try one of those. Right now we're seeing the slide that you're on, and then that works. Okay.
Okay, super.
Okay.
So today I'm going to shed some light into the SHIP and the VICAP program, provide a Medicare basics overview, which is going to speak to Edith's question, and then provide some insight on what's important to know for the Medicare open enrollment period. The State Health Insurance and Assistance Program is a national program across the United States of America. So that means there's one in all 50 states, to include Puerto Rico, Guam, Washington, D.C., and the U.S. Virgin Islands. As Steve mentioned, I am an employee of Arlington County's Agency on Aging, which is housed under the umbrella of Arlington County government, but there is a SHIP program that's available in your area. All SHIPs provide free, unbiased, confidential counseling around Medicare to the residents within their jurisdiction. In addition to providing counseling about Medicare, we also provide information and resources about Medicare Advantage plans, Medigap policies, Medicare savings programs. We help to counsel people on issues around Medicaid, long-term care, and other health insurances. Our goal is to educate, empower, and assist Medicare beneficiaries on their journey of navigating through the health insurance landscape. And we do that by working with individuals across all population groups, regardless of their um, English English speaking ability or their income or socioeconomic status. We do our best to maintain a culture of customer service focused programs and services, again, with the goal of meeting the needs of the entire population. I'd like to share some information about Medicare basics. I'm going to talk a little bit about original Medicare, transition over to Medicare Advantage, and then Steve, I believe that's the point of where I'll be able to take a pause and then open it up for questions. But to shed some light, I'd like to let people know that Medicare is a federal health insurance program for individuals that are 65 years of age and older, who have worked and paid 10 years of FICA taxes. But Medicare is also available to individuals with certain disabilities that are under the age of 65. The disabilities are deemed by the Social Security Administration. In order for a person that is under the age of 65 to receive Medicare, they must have received Social Security disability benefits for at least 24 months. There's also the option of individuals to become eligible or receive Medicare if they've been diagnosed with end of stage renal disease or ALS. And I also like to let folks know that in order for a person to get Medicare, they must be a United States citizen or a permanent legal resident who's lived in the US for 5 continuous years. There are 2 federal partners that the SHIP programs work very closely with. Social Security Administration is one because SSA is the federal partner that initiates the enrollment. When a person is turning 65, they should, by SSA's rules, receive what's called a Medicare and a Welcome to Medicare packet. If you're turning 65 and it's 3 months before your 65th birthday and you have not yet received the Welcome to Medicare package, please do raise your hand and contact the Social Security Administration by phone or through their website. And then that way they'll be able to get that to you, and then you can ensure you're enrolling in Parts A and or B on time. The other federal partner that we work very closely with is the Centers for Medicare and Medicaid Services, and they are the federal partners who actually administer the Medicare program. There are 4 parts of Medicare that I'd like to speak to. Part A is for hospital insurance, which helps to pay for inpatient hospital stays, skilled nursing facility care, home health care, hospice care, and things along those lines. There's Part B as in boy, also known as medical insurance. And medical insurance is used for all outpatient services. So it helps to cover medically necessary services like doctor visits and outpatient care. There's also Medicare Part C, which alludes to Edith's question. And Part C is the benefit that I like to consider that's bundled. So it includes Part A, B, and C, and sometimes Part D for prescription drug coverage. And then there's Medicare Part D as in David for prescription drug coverage. Here is a screenshot of original Medicare versus Medicare Advantage. I do want to just preface while we're on this slide that when people are interested in enrolling in Original Medicare, there's also the opportunity for them to enroll in what's called either a Medicare supplement insurance plan or a Medigap policy. A lot of times we get questions from individuals who maybe are working or have Medicaid. In those specific cases, the Medicaid plan or a person's FEHB or um, employer coverage serves as their Medigap policy. But in this instance, if you have Original Medicare, you do have the option or an opportunity to enroll in a Medigap policy. To the contrary, if you have a Medicare Advantage plan, again, this is the one that's bundled and oftentimes includes what's called extra benefits. It doesn't always include a Part D prescription drug plan, but we highly encourage people to enroll in one if they do not have one. Here, if you have a Medicare Advantage plan, it is important to know that it is against the law for a broker to sell you a Medigap policy. So in essence, Medigap policies only work with Original Medicare. If you've been sold a Medigap policy and you have a Medicare Advantage plan, that would be prime time for you to again raise your hand, contact the state health insurance and assistance program that's in your network or your locality. Regarding Part A, hospital insurance, I'd like to just plug here that while a CMS has not yet released the final numbers for 2024, I will say that for this year, and that should change within the next couple weeks, but for this year, the Part A premium for those who needed to purchase it is $506 a month. And then for those who have worked 30 to 39 quarters, if you needed to purchase Part A, the cost for that is $278 per month. These are, again, some of the highlights of what Part A covers that I talked about a few moments ago. As it relates to Part B for medical insurance, Part B for 2023 decreased to almost $165 a month. I don't know if many of you have heard of the 80-20 rule, but when it comes to Medicare, for Medicare approved services will pay 80%, and the 20% of coinsurance is then charged to the Medicare beneficiary. So in essence, Medicare pays 80%, and then the beneficiary pays 20% of the approved amount for services. Part B helps to cover all of these medically necessary things. I do want to plug here that there are a lot of individuals who are now seeking, in our office that is, more durable medical equipment. Durable medical equipment may mean that a person may need access to an oxygen tank or diabetic equipment or supplies or a wheelchair or cane or things of that nature. If it's approved by a physician, meaning if a person receives a prescription for the durable medical equipment or supply, that's when the 80-20 rule will apply. There are times when Medicare Parts A and B are necessary before being able to obtain things like a Medigap policy or a Medicare Advantage plan. So in order to enroll in Part C, aka a Medicare Advantage plan, you have to be enrolled in Medicare Part A and B. If a person is eligible for TRICARE for life, the same rule applies. And then if a person works for an employer that has less than 20 employees, it is important and actually necessary to have Parts A and B prior to that. There are certain things that Original Medicare does not cover. And Original Medicare doesn't cover the things outlined here. So dental care, eye exams, dentures, cosmetic surgery, massage therapy, etc. There are, though, other hospital or insurances that may cover it, like Medicaid, for example. So Medicaid could cover long-term care. A Medicare Advantage plan could cover uh, limited hearing aids or dental care. It just all depends. We do highly encourage individuals to please look at the fine print. I am going to talk a little bit later about the Medicare Plan Finder, because that's where we actually sift through and walk through the plan's information, and to inform individuals of what the plan covers. Our team also has had the privilege and the honor of helping individuals understand what's called their annual notice of change or explanation of benefits. Each plan sends out a lot of detailed information that specifically speaks to what they cover. So although there are some plans that do offer and cover some of these benefits, we do want to make sure that you're informed and understand just how much coverage is actually provided and offered. So as it relates to Medicare Part C, also known as Medicare Advantage plans, um, from this slide, I just want to drive home that it's really important to know that these plans are not based on income or anything of that nature. Um, this is health insurance that's available to everyone who is eligible to receive it. So if you're a Medicare recipient and you are considering enrolling in a Medicare Advantage plan, there's the option to do so. However, it's important to know that when you do, we do encourage people to please contact their physician's offices to make sure that the physician accepts the insurance prior to joining that plan, so that you can avert what could be, um, out of pocket, unnecessary out of pocket costs contributed, because the doctor may not be in network. Every plan has different rules that change every year. So, in addition to the rules changing every year, there are instances as well when a doctor may jump out of a network, and things of that nature. So, we encourage you to keep a pulse on that. If you have questions, of course, contact your local SHIP for more information. You must live in the plan's network. The network is the service area. And again, we'll walk through that as we're looking at the Medicare Plan Finder as well. And then just as a recap, Medicare Advantage plans do not work with Medigap policies, and it's against the law for a broker to help you to enroll or enroll you in a plan, in one of those plans. As it relates to Part D, prescription drug coverage, there are new numbers in the Medicare Plan Finder, which we'll look through in just a few minutes, but the 2023 drug premium costs estimate between $5 up to $100 a month for the drug plan, and then the drug deductible toggles or can toggle up to $550 a year. And it's also important to note that, and I'll talk about the Inflation Reduction Act too a little bit more in just a few minutes, but starting this year, at the top of this year, Congress approved the IRA. And one of the great benefits from that is that there's a $35 cap per month on insulin drugs, and that can be covered or that are covered under Medicare Part D programs. So here it is. HR 5376, also known as the Inflation Reduction Act, became law. And this opportunity provided individuals with the chance to obtain and get connected to insulin and durable medical equipment supplies, diabetic supplies at a much cheaper cost. There are other benefits that have come out of the IRA, including what's called the Part D low income subsidy. The Part D low income subsidy is a benefit offered by Social Security Administration to help individuals lower their out of pocket costs for Part D prescription drugs. And the Inflation Reduction Act will now provide the opportunity for people who are approved for the LIS program to receive the full benefit versus the partial benefit like they did prior. The IRA also allows Medicare to negotiate drug prices, and it caps the out of pocket cost to $2,000, which is phenomenal. And then there are some other benefits related to the ACA. It helps to lower premiums for millions of Americans. Sometimes we have worked with and received calls from individuals who are looking for a plan on the healthcare exchange, and that's something that we have helped them to attain as well. So in addition to the 4 parts of Medicare, Medigap policies are also available to individuals who are interested and who want additional coverage outside of original Medicare. It's important for individuals to know that Medigap policies are sold by private insurance companies. So our team provides education and information on Medigap policies, and then connects individuals to the State Corporation Commission's Bureau of Insurance, which is at the state level, so that they can help to get connected to a broker to help them enroll in a private insurance company. Medigap policies help to fill in the gaps that original Medicare does not, like deductibles, co-insurances, and co-payments. One wonderful thing that's come out of a lot of legislation and advocacy too is that Medigap policies are now available to individuals under the age of 65 years of age. Medicare open enrollment that Steve talked about is coming up, and it starts October 15th and it ends December 7th. During the Medicare open enrollment period, beneficiaries have the opportunity to be able to assess, enroll, or disenroll in either a Medicare Advantage plan or a prescription drug plan. For all individuals who make changes during the open enrollment period, their coverage will become effective January 1. The Plan Finder is a tool that our team uses to be able to help beneficiaries like you to make those changes. And after pausing and then opening up for questions, once we transition to the next and the final leg, that will be an opportunity for you to actually see snippets and screenshots of what the Plan Finder looks like, and then what you can do to maximize your healthcare and making the appropriate changes according to cost, coverage, et cetera, within the Plan Finder. So with that, I'm going to pause and turn it over to Steve and see if there are any questions.
All right. Okay, great. So I'm gonna, how about I go, let me look at a few of these questions, but feel free to say, let's answer that when I'm done. Okay. Let's see. Mary asks, is Medicare open season for current Medicare enrollees to make changes? I signed up for Medicare Part B last year for the first time. The open season for people to join Medicare was January 1 through March 31st. Is this still so? I find this confusing.
Yes. Well, thank you for your question. Medicare is confusing, and there are several enrollment periods. January through March is the general enrollment period that you were just talking about. The open enrollment period of starting October 15th is for individuals who currently have Medicare.
Okay, so open enrollment is only for people that have Medicare. And so
Yes.
if I am not signed up for Medicare, then I wait till January and then I sign up between January and March.
Yes, unless there's a special enrollment period, which is another period, enrollment period, that people have an opportunity to enroll in. So in order to enroll in a Part C plan for Medicare Advantage, you already have to have A and B. In
Okay,
order to enroll in a Part D plan, you have to have A and or B. So yes, you need to have Medicare currently to be able to make the assessment and or change or enroll in a Part C or Part D plan. However, we do make sure we are also counseling individuals who may not have Medicare, just generally speaking, right? But the goal of open enrollment is to be able to assess and or change and or enroll
okay.
in a Part C or Part D plan.
So if somebody calls you and you're helping them and they're not enrolled, you're going to discover that and then say,
Yes,
it's January. Okay, great. And
yes.
hopefully that answers that. Okay. Let's see. Somebody asks, when people are enrolled in Medicare Advantage plan, do they have the option to receive service from any Medicare provider since they also pay for A and B? This is confusing. I think everybody's
Yeah.
gonna ask the question and say this is confusing. Okay, did you understand that question?
Can you repeat it one more time? I'm
It's
sorry.
when people are enrolled in Medicare Advantage plan, do they have
Yes.
the option to receive service from any
Okay.
Medicare provider since they also pay Part A and Part B?
Okay. Yes and no. So we always look at leading with not wanting the clients we serve or individuals that we counsel to pay more than you need to pay for healthcare services because they're already very expensive. So you can, but we don't advise a person to do that, because if you choose any doctor without verifying that they are in the plan's network, that is a quick phone call, or you can contact your SHIP office and get guidance on having a professional to help you do that. Or you can contact the doctor's office directly and ask them if so for example, if you're looking at an Aetna plan, contact the doctor's office and ask them a direct question. Does this office, or does Dr. XYZ participate in and accept Aetna? Because sometimes Dr. XYZ may be out of the plan's network. Now, although they participate in Medicare, they will still see you and then they'll bill you on the back end. We have seen clients in our office who have done this and not verified and fact checked that the doctor is in network and receive bills of $100, $200, $300 after the service was rendered. So I would strongly encourage you and others that are here on this call to please, please, please contact the physician's office first. Make sure that they accept the insurance, make sure they're in network before scheduling the appointment.
Okay. And we've got a bunch of other questions. I think, Michelle, how about if you get through the rest of your slide deck and then we'll just do these open questions.
Okay.
There is one last one. It's from GM before we conclude, you get back onto it. Is
Okay.
our packets sent to you? Like, do people notify you that you now qualify for Medicare, or if you're not receiving Social Security?
No. So Social Security Administration is the housing body, if you will, of all things related to Medicare. This is where it initiates. If you have paid into the system and you are you've paid into the quarters and all those types of things, the notification should come by postal mail from Social Security Administration to say, you know, GM, you are now eligible to enroll in Part A and or B based on the quarters that you paid into. There's a lot of, unfortunately, there's a lot of scams, a lot of misinformation that's being generated out here. And there are a lot of scammers that are also sending people emails, text messages, flyers in the mail, the list goes on. Please do be leery and cautious and look at the information that you receive with an eagle eye to make sure that it is legitimate. If you're not sure whether it is legitimate, we do encourage you to please contact your local SHIP office. You can, I have people email me documents, or I may see the documents face to face. It just all depends. But make sure you get a second opinion on the information that you're receiving before you make a decision to move forward.
Okay, great. All right. So why don't we, folks, don't worry if you typed a question in and I didn't address it now, we'll get it at the end. And this is recorded. So if you have to jump off, you can come back. But Michelle, you want to keep on going and then
Yes.
we'll dive into those.
Okay. Yes, I'd like to spend a little bit of time walking through the Medicare Plan Finder. The most recent opportunity I had to look at it was this morning. Been keeping an eagle eye on it for sure for the open enrollment period. The 2024 plans are now uploaded within the Medicare Plan Finder. And this is something that our team uses to help people assess and shop for either Part C or Part D plans. Here is a screenshot of what you may see if you go to the URL medicare.gov, G-O-V. You'll be directed to this website to be able to look at current and then future plans for 2024. Remember how I mentioned that the plans that you look at or are viewing are based on your service area. The service area and the zip code are synonymous. The Medicare Plan Finder provides the opportunity for people to be able to build their prescription list, compare benefits and costs. You can also print copies of your Medicare card, and that's only if you have created a Medicare.gov account. With that, you can also view a status of your Medicare claims and deductibles as well. The Medicare Plan Finder provides the opportunity to make an assessment of 3 plans, whether that be Medicare Advantage or prescription drug plans. When you are looking and comparing the plans, it'll provide the space and the opportunity to do an eagle eye and look and have an overview to take a look at the costs, take a look at what's included, what's not included, and then further plan details to help you make an informed decision about the plan that you want to choose. When you're looking at prescription drug plans, for Part D plans, we do encourage people to lean towards selecting a plan and a pharmacy that says preferred. So see at the bottom of the screen, if you can, there are different pharmacies that I chose. I did a hypothetical search. I chose different pharmacies based on the zip code. And when you choose a preferred pharmacy, what you're going to find is that your out-of-pocket cost for prescriptions is going to be substantially less. If you look at the numbers based upon preferred, and then of course, out of network, if you all can see that. So under Silver Script, it says that Walgreens is out of network. You see the difference in the price cost? It's almost $700. So we do encourage people to please, when you're looking at the Medicare Plan Finder, and again, this is something SHIPS can help with as well, try to choose pharmacies that are preferred so you can avert that substantial out-of-pocket costs if they're not. The Plan Finder provides the opportunity for an individual to compare up to 5 pharmacies. And again, that's based on the zip code and where you, or if you're a caregiver and you're helping your loved one to walk through this process, where they reside. There are some new features within the Plan Finder that provides greater visibility on the plan's details. There is the discontinuation of mymedicare.gov, and now everything is being diverted and directed to medicare.gov's website. The insulin senior savings model, which was a prior feature, has been removed from the Plan Finder. And then there's the option of looking at in-network pharmacy finder, the pharmacy finder feature, which is new and something I wanted to bring to your attention. And with that, I'd like to share some resources and then close out the presentation and open it up again for any questions. So for Arlington County residents, feel free to contact us at 703-228-1725. But outside of Arlington County, if you're joining us today, remember that there's a SHIP program across the United States of America. And there are counselors and assistants that can assist you and walk you through this daunting process. Thank you.
Okay, awesome. This was amazing. And okay, we got a pile of questions here. I'm going to start going through them and do your best to answer them. And there's never a problem with saying, send me an email. And, actually what would be great, Michelle?
Yes, yes,
Take that slide right there and
yes.
see if you can cut and paste all that information and drop it into chat.
Okay.
Just select it while we're doing this. Okay. And if you're up for multitasking, I'm going to start reading a question from Betty.
Yes. Hi, Betty.
Okay. All right. Here, I'm going to, hold on a second here. Let me just, stop sharing your screen there. That way we don't need to see your screen. We can see your beautiful face.
Okay.
All right. Betty says, my husband paid a higher premium to cover high or unexpected drug costs, such as cancer therapy medication. Does that $2,000 include all prescription medication or some kind of formulary or limited list? So, and bear in mind, she was asking this question in the middle of your presentation.
Okay. Yes, unfortunately, all the formularies, Betty, don't cover the drugs all of the time. So it's really based on the plan that's being chosen. There are other organizations that I know my team and I have looked to, depending upon the type of drug that's needed. Sometimes there are nonprofit organizations that can help to offset the cost of the drug if it's not covered under a formulary, or there are times when my team and I have also looked at what's called patient assistance programs. If a person is eligible for one of those programs, that could be another route to take as well. But all of the drugs are not yet covered under the umbrella of the $2,000 cost, and some of them are being phased in over time.
Okay. All right. Talia says, someone I know was billed $64.50 per month by her insurance provider, and the rep explained that this is a penalty for late enrollment in Medicare. The insurance company is apparently collecting on behalf of the government, and this fee does not go towards any premium. It will be collected monthly forever. Can you speak about this policy? Number one,
Yeah.
is something like that true?
It can be, yes. There's what's called a lifetime penalty in Medicare. And
Whoa.
it's something that I talk to and speak to quite often because I don't like that either. I don't like the customers I work with to have to face or anything like this. But if you don't enroll on time, I mean, there are many rules and regulations that Medicare and CMS has. Late enrollment is one of those rules that will indicate whether a person has to pay a late enrollment penalty or not. There are some ways to be able to avert it. And one of them is to be able, if your income provides space for you to afford, or I mean, be eligible for Medicaid or one of the Medicare savings programs, that is one way to be able to avert the lifetime penalty that Medicare has put in place. And then on the Part D side for prescription drug coverage, if a person is eligible for extra help, the low income subsidy that I talked about earlier that's offered by Social Security Administration, that could be another way for an individual to avert a lifetime penalty. But I'm so sorry.
And when we're saying late enrollment in Medicare, and this penalty is assessed, like, give us an example of somebody who would be a late enrollment.
So if you turn 65 and you do not have what's called creditable drug coverage, so sometimes there are instances where people, okay, I just thought of one, Steve, thank you. So I talked to a beneficiary months ago. Her mother is 85 years of age. She has Medicare Part A and B, but she never enrolled in Part C or D. She had been getting her prescriptions from Europe all of these years. You're supposed to enroll in all of the parts in Medicare when you turn 65. She's in her 80s. She
Okay.
has bypassed, right? So that's an example of real life
Okay.
example.
So now, what's the window that we have? So like, let's say that I turn 65 and for whatever reason, or let's say I'm still working and I'm just like, don't even think about Medicare. I've got employee insurance or whatever. And now I'm 67 and I'm like, oh geez, I got to get on Medicare. So that would be an example of late enrollment.
Yes.
And under the current guidelines, I'm going to be charged this extra fee for.
That's correct.
Like, wow. Okay. Real eye opener that I never realized. So folks,
yes, it's for a lifetime. Yes.
65th birthday, you've got to make sure. And I guess to make it even more difficult, you've got to enroll between January and March.
That's correct.
Okay. All right. Really good thing. Somebody asked, can you share one of your slides again? The slide for non-Virginia programs, resources, and while you're loading that up, let's see.
Is it this one?
Let's see.
Or
No, there was one I think that you had that showed there, that one. Okay, yeah, the other one, the one it says resources. I think that's what you wanted to see. And actually, if there's any way you could cut and paste that and drop it into chat,
yes,
that would be great. The other thing you can do is send me your slide deck too, and I can
I'd be happy to
put that on the recording. Okay. Medigap policies. Are you saying all people under age 64 can get a Medigap policy, or only people with a disability under 64 who are on Medicare because of their disability?
Yes, the latter.
Okay. All right. And Betty asks, what is the official site of Medicare? Scammers often use something similar.
Yes.
Or that would make sense. And this is probably a big area of scammers, but what is the official Medicare site?
Medicare, let me put it in the chat, medicare.gov. I will put it in the chat because yes, that person is absolutely correct.
Okay, great. And actually here, I'm going to, while you're cutting and pasting, I'm going to bring it up on my screen. So
okay.
this is the official Medicare site, folks.
Yes.
And that's a great resource there. Okay. Next question is, in January 2023, Arlington County retirees went on to Medicare Advantage. Can I transfer to Medicare any year, or is there a 1-year window to go back to Medicare?
So if you're in a county-sponsored retirement plan, the rules are a little bit different. The county-sponsored retirement plans are different from the Medicare Advantage plans that are being offered on the Medicare.gov website. In that instance, I would encourage you to contact the HR department so that you're making sure you're still staying under the umbrella of what's possible for you. And that's, we've seen a lot of employers move towards Medicare Advantage plans. But again, I just want to drive home that the employer-sponsored Medicare Advantage plans and then the ones offered on Medicare.gov are not the same.
Okay. All right. Okay, now we got a state question here. I'm not sure if you can answer this, but Bonnie asks, if I move to Oregon, does UHC, United Healthcare, Medicare Advantage operate there as well?
Yeah, that would have to be a question that I would need to look into and follow up if that's okay.
Okay, great. And you've got folks, and on the recording, I'll have Michelle's contact info as well. Okay.
And I'll also see if I can quickly find the SHIP in Oregon. She said Oregon, correct?
Yeah, Oregon. Okay. And let's see here. Okay. Somebody says, however, if you have employer plan coverage, I will have a special enrollment period when it ends, not to be late. Employer, however, if you have employer plan of a special enrollment plan. So employer plans they have also special enrollment so that you're not. Okay.
Yes.
Okay. Betty said, Betty, you're going to get a gold star too. Lots of good questions. So if I have my 65th birthday in 2024, I need to enroll between January and March or any time before my actual birthday. I was thinking it was to start 3 months before my 65th birthday.
Yes, Betty. So it's that 7-month window. It's 3 months, excuse me, 3 months before you turn 65, the month of your 65th birthday, and then 3 months after is the window that you have to facilitate the enrollment.
Okay. But okay, she's also asking, but are you covered when you travel in the US? Well, yeah. What is traveling in the US out of state or abroad? Like, how does Medicare work there?
I would say the short answer based on time is that Medicare Advantage plans, the rule of thumb is Medicare Advantage plans generally do not cover out of country travel, etc. Same as for Medicare. That's where the Medigap policies would come into play. If you have original Medicare, you're able to consider enrolling in a Medigap policy that would then help to cover your healthcare expenses out of country.
Okay. All right. And then here's a follow-up to one of the questions that I read that may have not been that clear. It says, sorry for the bungled question. Here's what I meant to ask. Will a Medicare special enrollment period be made available once my employee plan ends when I retire?
Yes.
Does this avert the late enrollment penalty?
Yes.
Okay.
Yes.
All
yes.
Right.
And I put the number to the SHIP Oregon office in the chat for the person who.
Oh, nice. Thank you. Okay. All right. So now I'm going into chat and it looks like we're almost to the top of the hour, folks. We'll go a little bit long today, but we'll get to these. I want to make sure that we address these remaining questions. Belinda says, is a person required to take Medicare at 65 if they are employed and have been insured? And I guess this is the thing, Melinda, that I've learned today. You're not required to take it if you've got alternate health plans or you're buying your prescriptions overseas. But if you don't sign up, you will be penalized. You could have an additional fee added, penalized for a lifetime.
That's correct. And it's important to let Social Security know if you're still working. So you can delay enrollment if you want to, and C or D if you have creditable coverage. But it's important and I think it's CMS L65. I can find the form if a person wants to know, but there's a CMS form that is required for completion. Once that form is completed, you would send it in. Your employer's HR department does need to complete a part of that form. That is the way that you would communicate to CMS that you have current coverage.
Okay. Annette asks, in shopping for a Medicare Advantage, how can you evaluate the possible rehab services and physical services available to you? When leaving the hospital, good potential rehab facilities and PT options were extremely limited because I was told vendors do not want to work with Medicare Advantage.
Mm-hmm. There has been a shift away from vendors in that area with Medicare Advantage plans, but I will say that if you receive or when you receive what's called the annual notice of change that is mailed to individuals who have plans, I know it's a lot to read through and comb through, but those types of documents, explanation of benefits, annual notice of change, and things like that will provide you with insight into what the plan covers. If you need help or would like some support combing through that rich document, contact your local SHIP and they can help you to do that.
Okay, great. Okay. Long question from Kathleen regarding Medicap. The AARP United Healthcare Plan F was announced that their 2024 premium will cost about $5,000. I added up all my premiums from 2015 to 22 and all of the United Healthcare reimbursements for those years. There were 2 years where the reimbursement was around $5,000 for major surgery, one for unexpected cancer, the second for orthopedic. 7 years of total premiums were close to $25,000. The total UHC reimbursement was $15,000. How do I find what Medigap alternatives are? How do they compare with my current UHC plan F in cost and coverage? And one thing that I would sort of say before you answer, Michelle, is just insurance in general. The model of insurance is that oftentimes we are paying money in and not receiving benefits. None of us want to get sick or have our house burned down. But yeah, it can be frustrating when you do those analysis and you sort of see that you paid in more than you've received. But Michelle, to this person, Kathleen, any words of wisdom?
It sounds like an analysis would be helpful, and an analysis like an in-person, I'm not sure where you live or where the SHIP office is in your locality, but I think setting up an appointment to help sit down and actually walk through your personal situation would be the best next step that I could recommend, because we do an analysis and taking a look at the finer details of the plans, look at, talk to you about your personal situation, and then help you to make an assessment and determine next steps from there.
Okay, great. Okay, hearing aids. You haven't talked about hearing aids. What's the coverage there?
Mm-hmm. Medicaid can help to cover hearing aids. Generally, original Medicare does not provide coverage for hearing aids. Some Medicare Advantage plans may provide limited coverage for hearing aids. It just all depends. If you take a look at the Medicare.gov website on the Medicare Plan Finder, it will outline, and let me see, Steve, if I can. I did have a slide on that. It'll outline some of the benefits that, yes, here, let me share my screen quickly while I have the time so
Okay.
that you all can see what I'm looking at. But if you log into the Medicare Plan Finder and you're taking a look at the Medicare Advantage plans, if you can see at the bottom, and this is just a hypothetical, I've chosen 3 plans to take a look at for the purposes of this presentation. But under each plan, it'll show you that, Humana versus AARP versus Aetna provides different benefits under their programs. It doesn't, however, tell you the amount or and what capacity. So here's where, the opportunity provides itself for you to either comb through the Medicare.gov Plan Finder's website or talk with a SHIP counselor to take a look at the finer print to let you know as a consumer how much coverage is actually provided.
Okay, great. Okay. Let's see here. Oh boy. Where I think okay. I think we've got, okay. Oh, here's an Arlington County one from Betty. I retired from Arlington schools 7 years ago. In January 2023, we went to Medicare Advantage. Can I transfer to Medicare any year, or is there only 1 year window to go back to Medicare?
To go back, if she has Medicare, I don't understand that
She's
question.
got Medicare Advantage. She said, I retired from Arlington schools 7 years ago.
Mm-hmm.
And in 2023, we went on Medicare Advantage.
Mm-hmm.
Can I transfer back to Medicare on any year, or is there only 1 year window?
So that speaks to her. She's talking about her employer coverage is what it's now. She has an employer plan, an
Okay.
employer plan that's a Medicare Advantage plan. And I would suggest that, Betty, that you talk with the HR department to find out, because there is an opportunity if you want to switch back to original Medicare during the open enrollment period. I'm just not sure what the ramifications for you will be, though, because you have an employer sponsored plan. So
Okay.
you want to make sure you get full clarity on, because the rules for you are different from the rules for everyone else who may not be working. If
Okay.
we have a beneficiary that comes into our office with an MA plan and wants to switch, then it doesn't have employer coverage, they have more flexibilities to be able to do that. I would highly suggest you talk to the HR department just to make sure that you understand what, if any, what the ramifications are if you decide to switch back to original Medicare during the OEP period.
Okay. Now, you're a government employee, and I don't know if you can share your opinions, but Leslie asks, if we had Medicare for all, would it not be less confusing and more beneficial for everybody?
Well, that all depends. And I know that Medicare for all has been a hot topic and something that, a lot of people have been pushing for, including some legislative officials. I think that it's important to have choice, freedom of choice and options, and provide people with the opportunity to be able to choose what type of healthcare works best for them. I did provide the SHIP New York office phone number in the chat. Someone earlier asked about or
good.
stated something about New York. So that's
Yep.
that's the office for you. I think it was Kathleen.
Okay. And then, oh boy. Okay, folks, I think this is, we could probably go on for days here, on this topic, but the good news is that we have, shared, a lot of information. Let me address this one last question, and then, Michelle, be great to have you back on again.
Okay.
Somebody asked, snowbirds, people who spend several months in winter in warmer weather states such as Florida or Arizona, how do these people decide what Medicap and drug plans for each state? Or should they just keep original Medicare? And there's also saying, also for snowbirds who are dual eligible for both Medicare and Medicaid, since you say it's against the law to be sold a Medigap policy if you have Medicaid. Because I guess Medicaid is state specific. So can you add any clarity to these snowbirds and what have you?
Individuals who enroll in original Medicare have more choice and the option of choosing doctors that are in more in a plans network depending upon the state. There are some states that have a higher penetration rate of Medicare Advantage plans, which means that there are more doctors in that area that accept a higher rate of Medicare Advantage plans. So it all depends on where you're traveling to. The Better Medicare Alliance, Steve, I'm going to see if I can quickly find that, is a great website to look at. If you want to look at statistics like I do and get a better understanding of the penetration rates around the country, the Better Medicare Alliance will
Yeah, I've
provide a
got it
space for you.
here. I've got
Okay,
it. I'll share
thank you.
it with folks.
Thank you so much.
Better Medicare. Okay. This is the right one.
Yes.
Okay. All right. Great. Okay. All right. We have, I am, overwhelmed. This is very confusing, and, I have learned a lot. It's absolutely amazing. And, any sort of closing, thoughts or words, Michelle?
Outside of thank you so much for the opportunity, Kate and Steve, to present before you, I do want to encourage people. I know sometimes Medicare is daunting, but we do have professionals out here like myself who would like to make sure that everyone is informed and educated to make the best decisions for your personal situation. And so if you're not an Arlington County resident, you do have the contact information for the SHIP in your local area. You know, we do work for government organizations, nonprofits, et cetera, with the goal of wanting to help you make the best choice and decision. And the support that we provide is not financially based. So there's no financial incentive to help us direct you to the right path. We just want to see you get connected to plans and resources to help meet all of your needs. So contact your local SHIP in your area for more support and information. Thank you so much again, Kate and
Yeah.
Steve, and it's a pleasure to be with you today.
Yeah, thanks, Kate from VHC Health for bringing this to us. Kate, there you are. And yeah, and folks, I mean, it really is the fact that this is a free program. It's nationwide to help you navigate this. Take advantage of it, and even with that, I know it's still going to be challenging, but at least we've got some resources and other people that are there to help and support you. All right.
Great.
Okay, folks. Well, I can't believe it's Friday. And so everybody enjoy their weekend, and we'll see you next week.
Bye-bye, everyone.
Bye-bye. Thank you.